Toby, sorry, we can't hear it right now. Can you please share?
Look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our Health Hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.
Thank you, Toby, for that wonderful introduction. I just want to introduce myself. Hi, my name is Eloka. I'm your host this morning. I'm a doctor who's early in his medical career, just about to go into GP training. Today we're here with esteemed speaker, Dr. Julie. Dr. Julie, she's a highly respected GP who's got a lot of experience in maternal health and children's health. She's very active in the community as well. She's involved with a lot of organizations and initiatives. So I'll pass the floor over to her. Today she's going to be speaking about early parenthood and postpartum challenges for new parents.
Yeah, so thank you so much for that wonderful introduction. So yes, today I'm also wanted to thank the Caribbean and African Cultural Wellbeing Hub in Manchester who are joining us today. So thank you everyone for joining so far, and I hope more people join as we go through the presentation. So yes, my name is Julie, or Dr. Julie. I'm a GP based in Kent and London, and I'm very passionate about women's health, mental health, and also do a bit of aesthetics medicine as well. But today I'm going to share my screen with you all, and I'll show you what I'm going to be talking about. Okay. Yes, but today I'm going to be talking about early parenthood and the postpartum challenges and support for mothers, because I find that a lot of the discussion in terms of early parenthood is always directed around the child and how to do infant care effectively, but not enough attention has been given to new mothers and the struggles that they have. So I really just wanted to focus on this just to better prepare people for motherhood and to talk about the different supports and the challenges that they may experience whilst they are navigating this new journey. So today I want to try and make this talk as interactive as possible. So I start off with a question. So my first question is, how many trimesters are there in the pregnancy journey? And I don't know if anyone wants to comment in the chat, and we'll have a look and see if anyone gets the answer right. So I'll just give you a few moments just to respond to my question.
I'm not allowed to say, am I? No, is that cheating?
Oh yeah, you can guess as well. What would you say? 3, okay. Is there any more responses? Okay, so what I'm going to move on to is the answer. So there's actually 4 trimesters in pregnancy, in the pregnancy journey. So we usually think about the first 3 trimesters of pregnancy, but we don't also think about the postpartum period. So the 4th trimester, my next question is that with the 4th trimester, does anyone know how long this would last for? So again, I'll just give you a few moments just to look at the options and then enter it in the chat.
You had me there. I learned today.
Yeah, so a lot of people don't know this. So especially if you haven't gone through the journey of parenthood yourself. So yes, it's important just to be aware of. Okay, I don't know if you had any responses yet. Okay, so I'll go on to share the answer. So it is The fourth trimester lasts for the first 12 weeks following baby's birth. So just to give you some more information about the fourth trimester, as I mentioned, it's the first 12 weeks immediately following childbirth, and it's considered to be a critical time of adjustment for both baby and mother. So obviously we know that baby's coming into the world. They were in the safe comfort of the womb where they're getting all the nutrients needed given to them. They were in a warm environment. They never had to want for anything. And all of a sudden they have a sensory overload when they're exposed to the world. And all of a sudden they're experiencing different sounds, different smells, different feelings. So that can be, a very emotional time of adjustment for the baby, and they're known to cry the most in the first 12 weeks. And then for the mother, obviously you're going through the physical and emotional changes that occur just following childbirth. And also you're just adjusting to parenthood as well, and what this means, and also looking after your child. And in terms of, so you just get lots of different changes. And also what we noticed that in the fourth trimester, that even though it's the time that mothers needs the most support from medical professionals, this is the time where they've probably seen the least, sorry. So usually they're only seen at their 6 to 8 week check, where for majority of women, the experience is that this focus is solely on the baby, and that they don't get to really ask the questions that they may have encountered throughout this period. So I really just wanted to, empower women and parents with this information, so they know what sort of questions to be writing down to go to their GP with, and then know what's normal, what's not normal, and when to seek help. Okay. All right, so some of the changes that occurs in a woman's body. So you're healing from childbirth. So this would include vaginal delivery or cesarean section, and I'll talk about that in a little bit more. If you decide to breastfeed, you're also navigating that breastfeeding journey as well, which is so rewarding, but can be really challenging. And I really struggled myself in the first 4 weeks of breastfeeding. So I wanted to share some tips on how you can navigate this journey successfully, so you're able to successfully establish breastfeeding. Also, sleep deprivation is a game changer. I've never felt a tie like that in my life. And I thought that as a GP, I've done on calls, I've done night shifts. I know what fatigue is, I know what tiredness is, but nothing prepares you for the tiredness that you encounter in those first 12 weeks of being a new parent. It's just something out of this world. So again, we'll talk a bit about that as well. And again, whilst you're navigating all of these different things, you're also just going through all these different fluctuations in your hormones, mood swings, baby blues, and postpartum depression and anxiety, which is not commonly spoken about. So again, just to give some tips on how you can successfully navigate this and when to seek help. Okay, so in terms of healing from your delivery, so I think one of the main things is postpartum recovery. So if you have a vaginal delivery, you may have torn. So obviously there's different degrees of tears, even things as simple as like, you just have a graze. That can cause some problems as well in terms of passing urine, opening your bowels, just feeling uncomfortable down there. If you have an episiotomy, just in terms of aiding baby's delivery into the world, again, you're going to have some challenges in terms of healing physically. And then also if you had a cesarean section as well, so that you're basically recovering from major abdominal surgery, where for most people, if you had this kind of surgery outside of giving birth, you'll be told to just stay at home, rest and do nothing for 6 weeks. But with childbirth, you're given a brand new baby to look after from, minute one of giving birth. So again, you're experiencing pain, you're trying to manage your pain levels, you've got mobility problems. So again, these are just different problems you're experiencing. So a lot of people after giving birth, they're experiencing some soreness or discomfort in the vaginal area, also in the perineal area, and also in the abdominal region. You're also dealing with your stitches as well. Are they healing well? What are the signs of infection? You also might just have some discomfort. So after giving birth, what we may also notice is that they start to experience severe or quite strong periods cramps afterwards, and this is because the uterus is just contracting down back to its normal state or its normal size. So again, it goes from holding a big 7 to 9 pound baby, and it has to go back to that small size, or smaller than the size of your fist. So that's obviously the body going through a lot of physical changes. And then even after giving birth, some women may experience some physical bladder concerns. So passing urine can be really uncomfortable, especially if you have any sort of trauma to the perineal area and giving birth vaginally. And that's something that's not often discussed. So women are not prepared for when they first go for a wee, and the fact that it may be really uncomfortable. So something I tend to recommend for women if they're worried about this, or if they have any sort of tears, is that either when they first have their past urine or go for a wee, that they go and do it in the shower, or they will do it in a bath, just because that helps you just really dilute some of the acidity of the urine or the alkaline solution of the urine that can cause you to feel really uncomfortable. And something, yeah, people don't really talk about, but it's very, very common after childbirth is constipation. I myself really struggled with it. I was embarrassed to mention anything. So I went home and I suffered terribly. And I don't want no one else to suffer with this problem like I did. So in terms of constipation, this happens for many different reasons. First of all, you've had, trauma to the perineum area, you may have had surgery, you're taking quite strong pain relief. And we know that some of the side effects of pain relief is that you can be constipated, and that also it helps us, it slows down how food moves through your bowels. And with this, as food is moving through your bowels, it's, more and more water is being absorbed. So when it still does get to the bottom, it's very hard. So you can imagine that you've just had major surgery in your stomach, you don't want to strain on the toilet. So that's very scary thing to go through. And then also that you may have had a tear as well, or episiotomy, and then now you're having to apply pressure to try and open your bowel. So, if you're concerned that you haven't opened your bowel before leaving the hospital, ask for some laxatives before going home, just to make it an easier process for you. And then also with obviously carrying the baby, you're carrying 7 to 9 pounds in your stomach, not even counting the size of the womb and the weight of the womb and the fluid. It sort of weakens your pelvic floor, and these are the muscles that hold up your bladder, your womb, and also your bowels. And with this, people can then experience some difficulties controlling the bladder and the bowels after giving birth. So I'm going to share some tips in terms of recovery, because I know I've spoken of all the challenges you can experience, but I think it's also important to share the ways in which you can help your body to recover. So one of the things, which sounds impossible, but if and when you can, try and rest and relax as much as possible, just because this facilitates the body's healing process. So they always say nap when baby sleeps, or just accept help from others. So if someone says, I can look after baby, let them look after baby and go and have a nap. You will thank them so much, and you'll thank yourself later for just, letting go of it, and also just letting other people help out with the chores as well. Also making sure that even if you're not breastfeeding, you just need to make sure you're well hydrated, that you're making sure you're eating well. So obviously after giving birth, you're at high risk of having things like anemia, so low iron, because you may lose some blood giving birth. So you want to make sure you're really just replenishing all that nutrients after giving birth. And also it helps to just improve your energy levels, and also it helps with tissue repair as well. So we usually advise, having a diet that's high in iron, protein, and vitamins as well. And then be gentle with yourself. Obviously, try and rest as much as possible. And when you do move, don't overdo it. So just, take part in very light, low impact activities. I would say even the first week, maybe just take it easy, unless you, had a vaginal delivery and no complications. Yes, you might feel up to going for a walk, but if not, just really take it easy and just, manage your household activities in that first week or so. Okay, other things to think about, pain management. So even when you're going home, make sure that you do ask for pain management, especially if you're really struggling with it. There's no shame in asking for pain management. There are lots of medications that are safe to take when you're breastfeeding as well. So things like paracetamol, ibuprofen are perfectly safe to take, and they're very effective in terms of pain relief. So if you are in discomfort, please just let someone know. And as I mentioned about just having, you can use some warm compresses down below as well if you're really uncomfortable, or you can have these like baths as well, just to help you just soothe that area. And then also in terms of wound care, so just follow the healthcare's instructions, keeping the incision site clean and dry, changing dressings as needed, monitoring for signs of infection. So this would be increased pain on the site, any discharge in the site, or any redness around the site, or you might notice any sort of discoloration there. Then, and you feel worried about an infection, then just let your midwife or health visitor or even your GP know straight away. And then again, we always recommend that you do some pelvic floor exercises in pregnancy, but also that you continue to do that after pregnancy as well. That's really important. There's lots of videos that you can follow online. You can also look for exercises on the NHS website. And if you do find that you're having any problems controlling your bladder or your bowel, please do speak to a healthcare professional, because they can refer you to a specialist women's health physiotherapist who can give you some guided exercises. And if needed, they can refer you to a specialist for further intervention. And like I mentioned before, please do not be ashamed to ask for laxatives if you do need it. Okay, so we've gone through just the physical, or just the pain of, and the, the actual procedure of, giving birth. But then afterwards, also, you're going through postpartum bleeding. So the bleeding that you have after giving birth is known as lochia. So this is the bleeding and the discharge after birth, and it consists of blood and some mucus and a bit of tissues, and it can last for up to 6 weeks. Usually, you have heavy periods in the first 7 days after giving birth, and then this should then begin to lighten. If you find that the bleeding is not lightening or it's having an unusual odor, you're just having really heavy bleeding with clots, please do just let your healthcare professional know straight away. And after you finish the lochia, or after that's all passed or it's stopped, people will then ask, when is my period going to return? So this is quite a tricky question, depending on whether or not you're breastfeeding. So if you're not breastfeeding, your periods can return as soon as 4 to 6 weeks after giving birth. But if you are partially breastfeeding, this can be a lot longer. And this is due to something called, I don't what's the technical term, it's called lactational amenorrhea. And what happens is that when you're breastfeeding, produce a high level of a hormone called prolactin, which sort of in your brain is still trying to protect you from getting pregnant again, because it's like, okay, you've just given birth, you're looking after this baby, all your resources and energy is focused on this baby. Let's give you some time for your body to recover. So the way in which the body does this is that it stops your periods. And then this can be an effective way of, preventing pregnancies if you're exclusively breastfeeding, so you're not given any formula feeds, and also you haven't experienced your periods in the first 6 months after the child's birth, and it's up to 98% effective in terms of getting pregnant again. But if you continue to breastfeed after the 6 months as well, you may still find that depending on how much you're doing, especially if you're doing nighttime feeds, your periods may not return for up to a year or even more than that. So that's something just to be aware of, especially if you're thinking about, having children soon after one another. Okay, so now I'm going to go into a common dilemma for many parents and what they want to do. And I know there's lots of stigma on whether or not you're going to breastfeed versus bottle feeding, but I wanted to give you the options for both so that you can make an informed decision. Because ultimately, fed baby is best. No one asks any adult, were you breastfed or bottle fed as a baby? How long were you bottle fed or breastfed for? No one cares about that. So all that matters is that your baby is healthy and that it's well looked after. So first of all, just going through the options and all the benefits of bottle feeding. So there's nutritional benefits of bottle feeding. They're going to give you consistent and blended nutrition if you use quality formulas, and these are fortified with all the essential vitamins and minerals that you need. It's also very convenient as well in terms of it allows other people to feed the baby, although this can also happen if you express, but obviously there's extra effort in expressing milk. But if you're doing a formula feed, then you can just hand over to someone else who can help to feed baby. And also it's easy, especially in the first few weeks after giving birth, and just like looking after the baby, just to monitor exactly how much food and nutrients and fluid that they're intaking. So I would say that that's some of the benefits there. Also, some people may have some health considerations that they need to take into consideration. So with formula feeding, there's no risk of transmitting infections through milk. Bottle or formula feeding is suitable for mothers who cannot breastfeed for medical reasons. For instance, if they're on any medications or have any health conditions that mean they can't breastfeed, formula feeding is a perfectly safe and effective way of looking after your child. And but some of the challenges of bottle feeding is that it does lack some of the antibodies that you can get in breast milk. It can be a bit expensive over time, and it does require preparation and sanitation of the bottles as well. So with breastfeeding, I think I mentioned briefly before that, breastfeeding is a unique and very beautiful journey and a natural way to nourish your baby and bond with your baby. However, there are lots of challenges. So in terms of the benefits of breastfeeding, you're giving bespoke nutrition for your baby that adapts to your child's changing needs as they grow. So it's full of essential nutrients and also antibodies to support your baby's immune system. It's also easier for babies to digest or infants to digest, and it's cost effective. It costs you nothing. It's something that you have on you at all time, and you can give it to your baby whenever. Other health benefits for the baby, there's meant to be reduced risk of infections, allergies, and some chronic conditions. It also promotes healthy weight and reduces the risk of obesity. And the health benefits for mothers, that they may notice that it promotes faster postpartum recovery, and there's a lower risk long-term with some cancers such as breast and ovarian cancer, and also it just promotes bonding and attachment, so that skin-to-skin contact, and just improves and boosts the emotional connection between mother and baby. So some factors to consider, like I mentioned before, is mother's health. So if you have any medical problems, if you're unwell following the delivery, you might not have the capabilities to breastfeed, which is perfectly okay. Also, you need to think about babies' needs as well, because I meet so many mothers who are breastfeeding where their babies have, cow's milk protein allergy, which means that if they want to continue breastfeeding and they don't want their child to continue to suffer the side effects, they have to completely eliminate all dairy from their own diet. So it's not just eliminating it from babies. So with formula feed, you can just go out and get a bottle, a specialized formula that addresses this. But this is much more tricky to address when you have to completely eliminate it from your own diet. There may be other issues that babies may experience, such as tongue tie, which can cause some issues in terms of breastfeeding. And also, even for babies that are being breastfed, they still do recommend that you give them oral supplements as well, because sometimes they know that mother's not getting enough nutrients herself, so therefore she's not always able to give all the nutrients that baby needs. So she just needs to top it up with some vitamin drops. And then also you need to consider how soon are you going back to work. If you're going back to work quite quickly, you might not be able to be there to constantly feed your baby. Also in terms of support system as well, you might just find it more difficult to balance, and it might just be your personal preference to or to not breastfeed. So in terms of breastfeeding, there's going to be some initial discomfort, and it is a learning curve. I'm going to discuss more about the challenges in a few moments. That it does require some specialized diet and lifestyle adjustments for mothers. So such as you can't take certain medications, you can't drink alcohol. So these are things that mothers have to just bear in mind. And it can be demanding and tiring as well. Just waking up every 2 to 3 hours to feed baby is really difficult. And that's if your baby feeding on a schedule. Some babies feed on demand where they're on and off the breast constantly, which is even more challenging. Okay, so another question now is that what is the recommended duration for exclusive breastfeeding by the World Health Organization? So I'll just give people a few moments to look at the options and to give a response. Okay, anyone given any responses yet?
Yeah, so I'm seeing Fadunsi saying 6. Benedict says 4. I'm gonna go for 6 months.
Yeah.
I'm
So
gonna
yeah,
just
that's correct. Yeah. So the recommended duration for exclusive breastfeeding is 6 months. Just because we know that baby does require some additional nutritional support after that time. So in terms of tips for successful breastfeeding, first of all, just make sure that you have a good latch. So when you're latching baby, you need to make sure the mouth is wide open. You need to make sure that you're aiming the nipple to the roof of the mouth, and that the mouth is completely covering the nipple and also a good portion of the areola as well. So you don't want them to just be gripping onto the nipple, because that can cause significant trauma to nipple. It can cause pain and also cracked nipples and also blisters as well. So you want to make sure that they're latching on properly. So that's one of the ways in which, to make sure they're successfully establishing breastfeeding. Okay. Something else as well is also to look at your mother's position as well. So to make sure that you're holding them whatever way is comfortable for you. You can also get things like breastfeeding cushions as well, just to better support you. Because I know that myself, I ended up developing back pain and also wrist pain as well, just because I wasn't holding baby in the right position, and it just made it really uncomfortable. So just to really whatever works for you, whether it's laid back, sitting forward, lying on your side, just find what works for you and what makes you most comfortable to breastfeed. So just to make sure that you're comfortable too. And this may sound like an obvious one, but just to make sure that when you do go to sleep, that baby's as close to you as possible. Because again, this makes it a bit easier just in terms of just lifting them up and breastfeeding. Other tips is that even when you're not breastfeeding, especially if you're having any issues with your milk supply, is just to make sure that you're doing skin-to-skin contact as much as possible, because this just promotes the different hormones that helps the body to release milk. So that's another way in which we say, we encourage women to establish breastfeeding. Okay, and then also as well, I think in terms of preventing any trauma to the nipple, is that you want to make sure that when you unlatch them, that you're doing it safely. So what they usually advise is that if the baby doesn't come off themselves, and maybe that you feel that breast is empty or it's uncomfortable, what you can do is that you can put a clean finger into the corner of the mouth, and it just helps to gently loosen the suction. And then by doing that, it helps to prevent any trauma to the nipple. So other tips in terms of successfully establishing breastfeeding include seeking help. Do not be afraid to speak to your midwife, health visitor, friends, even parents, doctors. If you're having any issues breastfeeding or feel like you're not getting feeding them properly, they're not getting enough milk, ask for help as early as possible. You can also apply some nipple creams and ointments that you can get from places like Boots or Superdrug as well to the nipple after feeding as well. And most of them are actually safe to use when you're breastfeeding. So there's no need to actually wipe it off the nipple. You can just feed them straight away. Also, just to appreciate some of the healing benefits of breast milk. So sometimes if women are having any pain in the nipple, what they can do is just squeeze out a bit of breast milk and then just rub it on the nipple, and it helps with the healing. And also just avoid any sort of irritants. So people may notice that if they're using certain soaps, they can be quite harsh and drying to the skin. If you find that that's the case, then to avoid using those soaps, and to also just use like nice cotton bras as well, which are nice and breathable and doesn't really rub on the nipples. Something that really was a lifesaver for me in terms of establishing breastfeeding was a breast shield. So this is like a silicone teat that it's a nipple shape teat, and you put it on your nipple, and then it baby latches onto that, and it helps them to suck. So this was especially important for me because my son was premature, so his mouth wasn't able to open as wide, so he wasn't able to latch as well in the initial few weeks. So I mentioned I had some challenges in the first 4 weeks, so that was something I found to be a lifesaver. Although that is controversial because some people are concerned that it actually affects their milk supply. But again, it's just weighing up the benefit and the risk for you. So if you find that you're really, really struggling, you're about to give up, this might be the last thing that you try. You might find that helps you just to continue on that journey. Or if you find that you're breastfeeding, but it's reducing your supply, then maybe you might not want to use breast shield. Also with breast pads as well, which you use to prevent leakages, make sure you're changing it regularly because again, bacteria can grow on the breast pads, and then that could cause infections and thrush. Also, there's something called silver nursing cups as well, which has some silver has some natural and healing properties. So after breastfeeding, some women find it beneficial to put these cups into their bra and into their nipple. And again, with the cups, it has a little area where it collects some breast milk. So as I mentioned before, the healing properties of breast milk, the breast milk is in contact with the skin, it's helping to heal it and helps to just soothe the skin. If you're having a lot of discomfort, like I mentioned before, paracetamol and ibuprofen perfectly safe. So take some of that and see if it helps. And just make sure you take care of yourself. It's not always an easy journey because I thought, establishing breastfeeding, I'll just put the baby on me, I'll get all these hormones and I feel connected to my baby. But when I first did that, I actually experienced a lot of discomfort and pain and had to actually stop breastfeeding because it was so uncomfortable. And then I had to do it again with all these additional support. So it does take patience and persistence. So please be kind to yourself when you're going through this journey. Okay. And my next question now, I want to ask about some of the common challenges that breastfeeding mothers experience. So there's some options here. I'm going to give you a few moments to read through them again and then pick an option. And if you comment in the chat, and then we'll look through the responses in a minute. What do you think?
I'm seeing which one would be most likely to be a challenge.
Yes.
I'd say excessive milk production leading to engorgement. I can imagine that would be very, very challenging.
Yes.
Rapid weight loss for the mother. I don't know. Would people find that challenging or a good thing? I don't know. And
I do find it's a good thing.
and then improve sleep quality as well. Is that true? I don't
There's no such thing as sleep.
know.
Oh, I mean, some women are really lucky in it. Your baby may sleep properly throughout the night, but for a majority of us, it can be a bit challenging. And no, when you're breastfeeding, there is increased risk of breast infections such as mastitis as well. So yes, the first option was correct. So in terms of common breastfeeding challenges, people experience nipple pain, like I mentioned, and discomfort, and also cracked nipples. And this is often due to poor latching or not feeding frequently as well. So like I mentioned, just really make sure you're reviewing the latch. If you have any concerns, to speak to a medical professional, or you can also go to maybe research on Google your local breastfeeding cafe. And there's I'm going to give some resources and some websites at the end. So there's lots of different websites that you can find locally where you can find people local to you to support you in your breastfeeding journey. So that's something you can do just to better support you too.
Ruth says in the chat that there's a lot of taboo around difficulty with breastfeeding, but
Yes.
for some mothers, it is just too painful. We need to allow people more grace. Every mother's experience is different.
Yes, exactly. So that's why I was completely honest. when my son first latched on, I screamed and I said, get him off me. And I just sort of pulled him off because it was so painful and I wasn't expecting that. So it is really uncomfortable. I've spoken to many people who, when I'm going through that journey, they're like, oh yeah, it was painful. I'm like, why didn't you warn me about this before? I would have bought all these different things if I'd known before, but no one speaks about it. So I'm telling you openly that I struggle with myself. And I'm a doctor and I thought I knew everything. I thought, oh yes, I'm well trained, but no one prepared me for the challenges I would experience when I was breastfeeding. I thought I would have it down straight away. And I struggled myself. So if you are struggling, please be kind to yourself. If you need to top up with formula, I did. Because again, I had issues latching to begin with, and he breastfed for 16 months. So you can skip bottle feed or you can give formula in the beginning and you can still manage to have a successful breastfeeding journey. So please don't be too harsh on yourself thinking that that's the only way in which you can go about it. Okay, so yes, one of the most common challenges is breast engorgement. So the main reason why this happens is because you're having increased milk production. Like myself, you might not be able to feed as often as you would like. This may be due to, you might just be too tired yourself, which is absolutely acceptable. Also, if baby is unwell for any reason, you might not be able to feed as often. And then also due to improper latching. So when they're not latched properly, they're not really sucking as much of the breast milk out of the breast. And then therefore the milk the breast fills up with milk and it becomes engorged. So symptoms of this include that the breast will be swollen, it will feel quite firm, it will feel quite tender, and it's warm to touch. You may also notice that because it's swollen, that the nipples appear a bit flattened, and you may also have a bit of fever and discomfort as well. Okay, I'm going to talk about the management of this, but I feel like it goes in hand with a blocked milk duct as well. So similar causes for blocked milk duct, which is, infrequent breastfeeding or pumping, incomplete emptying of breast, which is usually due to poor latch, or that just wearing tight clothing or putting pressure on the breast. And symptoms of this again is localized lump. So you might just notice that there's a small lump or nodule that you feel in your breast. You might also have some tenderness or pain at the lump site. There might be some redness and some slight swelling, and there might be some slow milk flow from the affected breast as well. So ways in which you can manage this is by feeding frequently. So this is 8 to 12 times a day, which is a lot, which is why I said sleep is a myth in the first few weeks. So you need to just make sure that when you are feeding, that you are making sure that the baby is latching properly. Also, you can do some massaging as well and some hand expression just before feeding, just to stimulate the letdown as well. And then after breastfeeding, you might want to use some cold compresses just for about 15 to 20 minutes, just to help soothe this swelling and the pain. And before you start breastfeeding, you may want to use warm compresses just to aid milk flow. And again, you can take some ibuprofen for any pain or inflammation you might be having. And you can also wear supportive bras as well. And if you find that you're experiencing persistent pain, high fever, or ongoing latching issues, please do just seek medical help as soon as possible. Okay, so another common it can be quite common. Another common problem that can occur is mastitis. This is more of a serious condition. So if you do suspect that you may have this, it's important to seek medical attention straight away. So we'll talk a bit more about why it happens and some of the symptoms. So causes of this is a blocked milk duct. Which usually leads to bacterial infection. And then also it can also happen due to cracked or sore nipples, and it can happen as a result of infrequent feeding and again improper latch as well, which is why getting the latch right is so important in the beginning. And what can happen is that you can experience quite severe breast pain and tenderness. You can get a lot of redness and swelling, often in like a triangular pattern. You can also have quite severe fevers and chills. You can have flu-like symptoms and just feel really run down. And again, when you have mastitis, one of the things people want to do, because you're in a lot of pain when you're breastfeeding, one of the things you want to do is stop breastfeeding, but it is encouraged that you continue to breastfeed even though you have this mastitis, and that you seek medical attention. So you start on antibiotics by your GP or other healthcare professional, and that you also take, pain relief as needed. You can use warm compresses, continue to massage, and again, to look after yourself, rest as much as possible, and maintain and well hydrated. And then even if after you started antibiotics, if you're still getting a lot of discomfort and issues after 24, 48 hours, then you just need to probably go into hospital at that point in time, because sometimes what can happen is that you can develop an abscess, and this needs a small little cut to the breast just to drain out any extra fluids or infection from the breast. So if you find that you're having persistent pain and you're on antibiotics and you're doing all of the above, then please do go and seek further medical attention. Okay, and another common problem that can occur, this is the last problem I'm going to talk about on breastfeeding, is thrush. So this is due to a fungal infection. It can be due to having antibiotic use, so either you or baby. It can cause a feeling of cracked or sore nipples, and babies with thrush can also pass it to mother as well. So it's something where baby and mums can pass it back and forth to each other. So when you do get treatment, both of you need to be treated at the same time, otherwise you're just going to reinfect each other. So some of the symptoms that a mother may experience is that they may get itching, burning nipples. They may notice some shiny or flaky skin around the areola, or they might get sharp shooting breast pain during or after breastfeeding. And then with the baby, you might notice that they have like a white patches in their mouth or general fuzziness, and also they may be suffering from nappy rash as well. So these are the signs of it. But with thrush, like I mentioned, it's so common. So if you do suspect you have thrush, go and book an appointment with your GP, and they'll be able to give you some antifungal treatment for you and baby. In terms of preventing it from happening again, we advise that you wash your hands frequently, making sure you're sterilizing all pacifiers, all dummies, and also all bottles thoroughly, that you're doing adequate breast and nipple care. So keeping the nipples dry, that you're using breast pads and that you're changing them often. Also because thrush or fungal infections, they love sugar. You're advised that you try and cut down the amount of sugar that you're having, just because it can promote growth of this. And again, like I said before, just make sure that you and baby both treated just to prevent reinfection. Okay, so now I'm going to move on to maybe more of a sensitive topic. So if anyone finds this a bit difficult, please feel free just to step away from the screen for a few moments. But I am going to talk about some of the emotional challenges for being a new mother. So it's a wonderful experience, but it can be overwhelming. And this is due to just the fact of, you're dealing with looking after a child, or if you have one child, now you're looking after two children, and it's just, just into that new role. And also there's so much hormonal changes that are occurring in your body as well. So there's fluctuations in your hormones, it's going to impact your mood, your energy levels, and it also can impact your physical recovery. Also, again, with becoming a mother of one or two or three or four children, there's a change in your identity. So you might feel like you're losing yourself. And that can also lead to quite feelings of feeling quite emotional, feeling quite low. People can also feel quite isolated as well when you become a new mother. Because initially you get everyone who wants to come and visit you in the first 4 weeks, but then after that, everyone's got work or everyone's got their own family. And then all of a sudden it's just you and baby, and it's just the two of you all day, and it can be quite a lonely experience. So I would encourage, try and join any mother and baby groups in your local area, or if you have any friends, if you're lucky enough to have friends who are also going through pregnancy or just giving birth, then obviously try and meet up with them as often as possible, just because you can both relate to each other's journey. But if you don't have that family support, it can be quite isolating. So therefore, it can also cause you to feel quite low as well. And having a new baby can cause a lot of anxiety, just in terms of, are they sleeping well? Oh my gosh, they made this sound. Is that normal? Oh my gosh, I haven't pooed. All sorts of things can be happening in baby that can cause you to have increased anxiety and stress. So again, that can also have quite an emotional toll on mothers as well. And on top of all of this, you're also sleep deprived as well. So you're trying to adjust to your baby's sleeping patterns, their irregular sleep cycles, the fact that they're waking up frequently, either just for feeding or comfort. And I found the fact that sometimes they wake up for comfort quite challenging, because I'm like, you just fed 20 minutes ago. I know that you're full, but now you just want to use me as your dummy. And that's quite difficult because I can't sleep, but baby's sleeping. So again, that's quite a challenging time as well. So again, it's such a whirlwind of a time. So lots of mothers do struggle, and it's okay to ask for help. So I'm sure everyone is aware about Mental Health Awareness Week as well. So it's okay to speak up about your struggles, let your partner, let family know, or speak to a healthcare professional if you're struggling. So strategies for coping in this period, maybe beforehand trying to build a supportive network. So if you've got any antenatal classes in your local area, try and join them. Some people join NCT groups. Although I do know that a challenge for many people, including myself, because I joined the NCT group, but there was no one who looked like me there. So I found there was no one who related to my journey in terms of parenting. And I actually didn't really make friends from my NCT group. It was only later on from going to mother and baby groups where I met people who actually looked like me, that I actually felt like I was able to build a supportive network. But again, like I said, going through those first few weeks was quite isolating, especially since I think we started to join the baby groups maybe after about 6 weeks. So this first 6 week or 2 weeks in between when everyone was coming, and then I was just left alone with baby. It was just quite a strange time. Also, just to make sure you're looking after yourself. So try and rest. I know everyone says this. I struggle with resting as well and just letting someone else look after the baby because I want to be there all the time. But accept help. Like I said, you'll be grateful to yourself later on. Make sure you're drinking and you're eating and that you're doing any sort of activities that promote well-being. So even if that's just having a few hours sleep, that's absolutely fine as well. Or if you want to go for a walk, you can do that too. And try and communicate your emotions as you're going through them as well. So you can communicate, like I mentioned, with family and friends, and also medical professionals if you need to. And yes, just seeking help quickly if you do feel like things are taking a turn for the worse. So in terms of people supporting new mothers, so whether this is a partner or family members, just try and have patience for them. Maybe they might not always call you back. You might send them a message. You might not get a message back for 3 days. It doesn't mean they don't care about you. It just means that they're probably just feeling a bit overwhelmed. So just try and still remain supportive towards them and just validate the experiences and the challenges that they may be going through. Again, especially with the breastfeeding, bottle feeding, whatever they decide to do, support them in that journey and don't make them feel guilty about whatever they do. Also offer practical support. So, offer to clean the house, bring food along. That's amazing. Please bring food. I think everyone appreciates it. And even offering things like childcare. That's a bit sensitive topics. I know some mums don't want that, but definitely come around and just help to clean up the house and bring food. And I think they'll be really grateful. And again, maybe just always just check in and ask, how they're actually really doing, how they're doing in terms of their emotional and their mental well-being, and just encouraging an open environment of communication. Okay, so I'm coming to that brings me to the end of my talk. So here's some resources that you can access. I'm happy to share this slide deck with anyone who wants to look through it later on for further information. And then now is the time just to promote questions. And also thank you so much for joining us today and listening.
Thank you so much, Julie. That was such an informative talk. Wow, you guys really go through a lot, honestly. We're very great, all the men out there, we're very grateful for it. There's a lot of questions actually. And there's quite a few. I'm just scrolling through the chat. Questions, I think there's some in the chat, some from YouTube, but one of them is, what is an episiotomy?
Okay, so this is where they may give you a cut to your perineum, which I had to pitch to show you. So essentially this is the space in between your vaginal opening and the anus, and they may give you a cut just to help baby pass through. So this is usually when maybe baby's head is about to come through and they feel like if you're not stretching far enough, they may just give you a surgical cut. So it's a cut which they try to prevent you having any severe tears, because essentially when you give birth, you don't want to have a third or fourth degree tear because that can cause all sorts of long-term problems. So they give you a smaller cut that's more precise in the right area so that if it does tear any further, it will heal well. So that's a episiotomy. So yeah, but then when they've done that, they stitch you up afterwards. So they stitch you back together, but you can still have some challenges recovering after that.
Right, okay. Thank you. Another question, what exactly do you mean by breast engorgement?
Okay.
Yeah.
So after giving birth, when your milk is coming in, it's normal for breasts to become fuller, more heavier, maybe a little bit more tender. But this is where it goes a step further than that, where you actually see that the breast is becoming, really swollen, and you can feel that it's quite heavy, it's very tender to touch. So that's when I wish, because when I was looking online for images to put up, I found lots of images of white women with breast engorgement, but I didn't find any images of women of color, so not even brown women. So I felt like it was really difficult for me to actually show what it would look like in a black woman, and because obviously you see white women, it's completely different how it looks, but because I usually say it looks a bit pink. Oh, nice, it might not necessarily look pink, it might look more a bit red, purpley, or even just a little bit more discolored brown. Or you might not even see discoloration, it might just be how it feels. So it's just really that you can feel it feels quite full. And when you actually feel it, the breast feels quite hard as well. So then I'll say that would be signs of engorgement.
Thank you
Thank you
very
for
much.
Dr. Jukes. Sorry.
Sorry, Ruth, your microphone's really crackly again, I think.
Oh dear. No worries. I'll put it in.
Yeah. Oh, okay. No? Okay, just yeah, I'll pop it in the chat and then
Yeah, I
I'll
think so. Yeah.
next question, which is a very interesting one.
Mm.
Um, this is from Bisola.
Mm.
She asks, why does it seem as if there's such a special intense focus and how and when breastfeeding is done in the Western world. In other countries, like in Africa, women kind of just get on with it, and the rest of the world they just get on with it, especially in Africa where they feed and just go about their business. So why is there such a focus on it in the Western world, basically?
I think because we're tired of suffering in silence. I think if you speak to our parents, when I speak to my mom, oh yeah, breastfeeding was really difficult. She's like, oh yes, it was. But I was like, why didn't you tell me this before? Maybe I'm more soft and more gentle. But I just wish that we just spoke about things more openly, have an open dialogue. Why do we need to suffer? If there's a way in which we can make the process easier and not as uncomfortable, then let's do it. I don't. I'm past that, you know, for or sort of mind frame where you must struggle for everything. You must be in silent. You can't complain about anything. If something is difficult, speak up about it because most likely you're going to be in a room with 10 other women, and at least two other women will probably be struggling with the same thing that you are. So speak openly about it. So I think it's just more so that we speak more openly about these things. So if you go to your parents, I'm sure they don't really talk about breastfeeding and how it's meant to feel. All they know is that, yes, you need to do it. And if you're doing it, you're doing well. But they don't ask you about how's that journey actually going for you? Are you enjoying it? Are you struggling? It's not really a conversation that people have.
That's it's a very important answer. Yeah, just to kind of share how we're all feeling. So yeah, you don't have to struggle in silence. That was
Mhm.
really, really important. Ruth is asking if you could stop sharing your slides so
Oh,
that
yes.
see our beautiful smiling faces. Thanks, Ruth.
Oh, sorry, I didn't realize you couldn't see. Sorry.
And, um,
Thank you.
okay, more questions. Um, oh yes, this is one I wanted to know as well. What is tongue tie?
Okay, so underneath your tongue, there is a connection between the floor of your tongue and the bottom of your tongue. And then usually your tongue should be able to move quite freely. So you should be able to stick your tongue out fully, you should be able to touch the roof of your mouth and bend it backwards. But with tongue tie, this is where the connection is longer. So you notice that babies might not be able to fully poke out their tongue, or they might not be able to lift up the tongue properly. And then when they do have this problem, this causes issues with they're not able to suck effectively, and then therefore it's going to cause women challenges when they're breastfeeding, or even sometimes with the bottle, depending on how severe it is. So if there's any concerns about you're having difficulties breastfeeding or establishing it, you're reading a lot of discomfort, even in the hospital, there are like breastfeeding consultants that you can speak to. You can actually look at your baby for tongue tie, and then they can go through a quick procedure that's performed very commonly, hundreds of it performed per day, and it could just snip the tongue, and it allows baby to breastfeed comfortably after that.
Yeah, thank you. I understand that a little bit more. Um, some questions about breastfeeding about this is from Molly on YouTube. She wants to know about the length of time for exclusive breastfeeding. She was told that in countries where nutrition is an issue, mothers should breastfeed for longer.
Yeah, so I think if there's any nutritional problems, then obviously breastfeed for longer. Like I said, I breastfed for 16 months. So just do what feels right for you. But it's recommended that at 6 months you start to wean, so you start to introduce some solids. But it doesn't mean that you have to stop breastfeeding at 6 months. You can still continue to breastfeed, but you do need to supplement the diet with some foods as well.
Hmm, Okay. I hope that answers your question, Molly. Another question from Anne on YouTube. She's asking, postpartum, this is an important question. Postpartum depression can go unrecognized. Can it continue to almost 2 years after?
Yes, absolutely. So, for anyone who is under perinatal psychiatry for whatever reason, if they're struggling with their mental health in pregnancy or just after giving child or just after giving birth, they can be referred to the perinatal psychiatrist, which is a specialized team for mothers who have just given birth, and they look after mothers for the first 2 years. So they recognize that it can take up to 2 years for all your hormones to regulate and for you to start to feel like yourself. So most women, when you do speak to them, they're like, when did you start to feel like yourself again? And they'll probably say, it was actually 2 years after giving birth,
Mm.
just because it is recognized that it does take up that amount of time for you to fully recover, both physically and emotionally from childbirth.
And if it continues for longer than 2 years, is there any like special kind of, can it continue for a long 2 years or does it go into something else after 2 years, basically?
Um, it can continue after the 2 years. I probably will just refer to it more as anxiety and depression after that,
Mm.
which can be managed by your GP, or if you do need any more support, they can always refer you to community psychiatry teams as well for additional input.
And just a quick one, a question that I want to know, what are the like basic signs of postpartum depression?
Okay, so they usually say baby blues can happen for the first 10 days. So this is where the mum's really emotional, she may feel low, quite anxious during that time. And then anything extending after that, that can be entering more the post-depression realm. So other signs that be externally, people may notice that you're more withdrawn from people, that you're not really acting like yourself, that perhaps they may notice that you say maybe some odd things, that you're not really interacting or responding as they would expect with babies. Maybe you're not quick to pick them up when they're crying, you might leave them a bit longer. They may notice that maybe you're not looking after yourself as well, that, you know, maybe not getting out of bed to get dressed or to have a shower. It's difficult to do that on the best of days anyways, even if you're feeling completely well, but they might just notice that there's just something there that's different to you. And again, you might be more tired and all, but it's really difficult because you're going to be tired because you're breastfeeding or looking after a newborn anyways, but you're
Mm,
just really fatigued, you're not really engaging with others, you're more withdrawn. These are signs for other people that you may be going through depression, or even in terms of anxiety. Anxiety is something that often doesn't go diagnosed because it comes across as you just being like an anxious mother, that you really being overprotective of your child. So you might be going to the GP frequently for every little problem. You might not
mm,
want anyone else to look after your baby. You might worry about, oh, you know, just about things that are completely out there, but to you is really serious at that time. Going wrong with your baby, that maybe, oh no, I can't go to sleep because baby might roll over. I can't do this because this might happen. So you might just be having like irrational thoughts. And again, that's why it's always good to just talk about things with other people so that maybe if you are expressing some irrational thoughts, there might be someone else just about something be like, no, that's not likely to happen. Why do you think that? And maybe just really probe it a bit more. And then by doing so, they might be able to uncover that, yes, you may be suffering with postpartum anxiety. And again, you can speak to your GP or go back to the perinatal psychiatry team about different options, whether it's counseling, therapy, or like cognitive behavioral therapy or medications if that's what you need to support you.
Thank you. Thank you for that answer. It's really informative. I've got a question from Q, from YouTube. She asks about diabetes, type 2 diabetes in pregnancies. She's concerned about how it can make pregnancy more high risk. Would you be able to shed more light on that?
Yes, so in terms of when you're diagnosed with gestational diabetes, they diagnose it from, so when you have a blood test, the number that they're looking for is anything above 42 or above. So from 42 to 47, you're considered to have gestational diabetes, and they usually manage anyone within that range with their diet. So you'll usually be referred to the diabetes or gestational diabetes clinic, and you'll have someone who'll go through your diet and just really tell you about exercising, what you should and shouldn't be eating in order just to help you to better manage your control of your sugars. If you are above 48, if you're 48 or above, then that's when they probably would encourage you to start medication. So you may have to start things like metformin or insulin, depending on how high your number is. And in terms of complications, the reason why we're concerned about diabetes in pregnancy is because it can lead to bigger baby, which people can say is good, but the only problem with having a bigger baby is that it can lead to complications with delivery. So if baby's too big, they might not be able to pass through the birth canal properly, meaning that they may get stuck or they may get shoulder dystocia where the shoulder gets stuck and then they have to do certain maneuvers to help baby come out. But then when they do these maneuvers, they're more risk to causing trauma to both mum when they're bringing baby out and also to baby as well, causing long-term disability. So that's one of the major concerns about it. And then also if you do have gestational diabetes, I believe you're 50% more likely to develop diabetes later on in your life as well. So it's just indicator of things that may come on later on.
Mm, okay. Thank you again for a very informative answer. Um, I have another answer for myself. Say if you are a partner, and obviously your partner's giving birth, what's the best way to support your partner through these challenges like depression and breastfeeding and the emotional changes, etc., etc.
I think even though she might not want to, but I think trying to get her to sleep, because I think sleep does resolve a lot of things. And we do know for sleep is a trigger for anxiety and depression anyways. For most people, they're triggered for their mental health. So letting her have some dedicated time when she has time to rest and you look after baby.
Mm,
Um, So maybe encourage her to, depending if she's breastfeeding or bottle feeding or given the formula, maybe to encourage her to express her milk so that you can take over maybe some of the nights as well. Because again, sometimes when you're breastfeeding, the nights fall solely on the mother, and that's really challenging. But if the woman is able to either give the formula, a feed, or to express milk, then you can take over some of those duties, just allow her to rest. And just really like talking to her, just checking in on how she's getting on. If you feel like she's struggling, then you can also seek help on her behalf as well. So you can book the appointment for her to go to the GP and take her and go along with her and tell them that you're worried about some this is one of the problems she's having. So just really being vigilant and supporting in every way possible in terms of if she's struggling with her healing as well, being there to make sure things are close to her so she doesn't have to move too much, looking after baby. Yeah, just being supportive, just really just addressing all of her needs. That's the way in which you can help. And it's different for every single person, but yeah.
Thank you. Thank you very much. Question from Pamela. The birth trauma report references yet another again the poor outcomes of Black women during the birthing journey. How do GPs take into account all this when women attend for their postnatal checks? Are they trained to be more compassionate? Do they ask more questions to really understand the experience from a cultural perspective? Or shaking your head there.
No, being completely honest, no, there's not enough time to do that in that appointment. So I would usually say if you're really concerned, you book a separate appointment to discuss it because it's not going to get addressed at the 6 to 8 week check properly. As much as we try and do our best, usually, because I'm actually doing some research in this phase at the moment in the Kent and Medway area, or in the Dartford area, I should say, where I'm actually looking at women's experience of their postnatal check, where we're not just talking about mothers and babies and what we do for babies, we're talking about what do we actually do for the women. And a lot of women say that they don't have enough time to express all of their concerns. Sometimes they don't always feel comfortable to express all of their concerns as well. So this is why I think this having a talk like this is important, so you can know some of the challenges you can experience, and maybe even write it down just in case you do get in a room and forget. And I would say book another appointment just to really talk about yourself. So this is where maybe partners and families can come in, where they can look after the baby and allow you to go to the appointment and really just discuss all of your struggles you may be having. And this can either be in person or also via the phone, but we're not particularly trained to address it. I do try and take better care of my Black and brown ladies when they do come to see me, but I can't say it's the same thing for all my colleagues, and it's not specific training. There is training available out there, but I'm not sure everyone is accessing this training and or wants to access it at the moment. So it is a
Mhm,
growing struggle.
mhm, mhm.
And also sometimes when you do, so sometimes when I do actually ask questions, sometimes I feel like people are a bit hesitant to share their story. They don't really want to say, oh yeah, I'm struggling. Like you mentioned, someone mentioned before about breastfeeding that, oh, it's in the Western world, we talk about it a lot more. But it's also this mindset that we don't openly discuss all of our struggles when we do go to the GP. And also there's this trust between the healthcare professional and the patient as well, where the patient doesn't feel like if I tell you my problems, you're going to actually care. So why should I bother? So it's also all of these things that can be difficult. And if you do find that don't feel confident speaking up for yourself, then maybe you might want to bring someone along with you who can advocate for you if you don't feel like you can, adequately express your concerns or express what's going on in your body.
Mm, mm. Okay. Forgive me if you've answered this before, but is there kind of resources for new Black and brown mums that you can access to kind of do what you were talking about just now, like sharing more and things like that?
Yeah, so again, this is something I'm working on. So in the Dartford area, I'm trying to collate the different services available. So that are run by Black and brown people in the community, just so that women, when they do go to these places, they feel comfortable speaking there. Because again, there are lots of different networks available which you can speak to your GP or your health visitor about in your local area. But it's not always people who look like you, who understand your particular journey that you're going through. So sometimes I do say the best place to find these networks is things like Instagram. You can try and well, you have to find WhatsApp groups that you can join, and where they can sometimes they post different events and different things going on in your area. So you can start to go along to these things, and also Googling local events in your area as well. But places like Con are always a good place to start, just in terms of going on the website and seeing what services are available.
Awesome. Thank you so much. Um, Ruth, when does this finish, by the way? Because I feel like we could be here for ages. It's a very good talk. Um, Ruth? No?
Okay.
Should we keep
Um,
going?
we can keep going if you have any more questions, or we can hand it over to Benedict
Okay,
when you.
that's good. I mean, it's a very important topic. If there's any more questions, feel free to ask. Oh, yep, another question from Pamela. She said, "Sorry if you covered this, but is it true that those who breastfeed are lower at risk of heart disease and cancers?"
Um, Cancers, yes. Heart disease, I'm not too sure about that one. I would have to get back to you on that. But yes, there's a reduced risk of breast cancer and ovarian cancer with breastfeeding. That correlates to the length of time that you do breastfeed for. But the strokes and heart disease, I'm not too sure on that one actually. I would need to go and research.
I have a question with regards to breastfeeding. Is there a stigma around breastfeeding in the women's community about because some people may not want to breastfeed over doing it. Yeah.
Um, I think again within my circle of people, I think there's more of a stigma against not breastfeeding, probably. If you're the
Mhm.
one to bring out your formula bottle, that people might look at you a bit weird or you feel a bit uncomfortable. But certainly something that's strange that happened to me is that because I breastfed for 16 months, even though it's not the longest I've had of amongst my friendship group, I had stigma from people like, oh, you're still breastfeeding. Oh, like, oh, that's unusual that you're doing it for too long. Like, you're only meant to do it for the 6 months and then you stop there. But my son wouldn't stop. So I continued on until he was ready to stop breastfeeding or we were ready to stop. So I found there was stigma actually on the reverse in terms of now I'm doing it for too long and it's making other people uncomfortable. So I think every community is slightly different. There are some people who's like, oh no, I don't want to breastfeed, and that's completely fine. I know many people who've done that and that they're happy. And then I did it and I had all my challenges. So they probably look at me and they're like, did you make the right decision? And I'm not, there's certain days or weeks where I was actually like, am I doing the right thing going through this journey? Is it worth it? But
Mm.
it was the best thing for me and my son, but everyone's journey is completely different.
Oh, thank you so much for for sharing your experience there. Um, Ruth is asking to make sure everyone knows about the oh this sorry, let me just scroll up.
The
Uh,
Black Awards, is that what it is?
yes, the wonderful work that we're doing in Cannes. There is the Black Awards that's the Cannes Caribbean and African Health Network is hosting. This is on Saturday, the 27th of July. It will be at 6 o'clock till late. This is at the Park Plasma in Westminster Bridge in London. Tickets, there's a poster that's been posted onto the chat. Tickets for early bird about £125 per person. That is before 31st of May. After 31st of May, it's £150 per person. And there's a dress code, nice and fancy, dress code, which is tie. So basically, this is an event where awards will be kind of given to people across the healthcare sector. They'll be recognized for the work that they've been doing.
That
So
is
yeah,
for Black healthcare professionals. There's
Black
never
healthcare,
been,
yeah.
yeah, there's never been awards like this that's recognizing the achievement of Black health professionals in the community. So we are doing such amazing work, and we often get diluted by other communities that we're not always recognized. So this is specifically to celebrate us.
Thank you very much. Hope to see you guys there. Um, I think I'm going to pass it over to Peace now, who's going to do the closing.
Yeah. Thank you so much for joining us. Thank you.
Oh, and yes, thank you. Sorry, Julie, that was such a wonderful talk. It was very, very informative. There's a lot of people in the chat. Says there's 38 participants on Zoom alone, and there's more on YouTube. So I must have taken something really good for that. Thank you so much. I learned a lot as well myself. So thank
Mhm.
you.
Thank you.
Right. Thank you so much, Dr. Eloka, for hosting. Really did well. Thank you.
Welcome.
And to Dr. Julia, as usual, always giving her best in terms of providing insights. And I think I personally found today's session really beneficial. So thank you so much to you both. So before we wrap up today's session, I would just be coming up with ongoing kind of programs and initiatives that we run at CAN and some upcoming events as well. So just give me a second to please share my screen. Right. So next week Saturday will be another health hour session from 11 o'clock to 12:15. So just similar to what we had today, it's going to be another insightful session where you have like a Black clinician coming to talk about health conditions that affect Black people. So please do well to join us again next week. On Tuesday, as usual, we have our healthy heart session that focuses on physical activity, healthy lifestyle, diet, and etc. And this next week Tuesday, being the 21st of May, from 6:30 p.m. to 8 p.m., we'll be exploring dietary links to Alzheimer's disease, followed by our physical activity for the last 30 minutes of the session. So please do well to tune in at 6:30 p.m. on Tuesday. Right. And then for those in North Manchester, just to let you know that there is an ongoing diabetes peer-to-peer support group. So if you know anyone who is if you're on the call with diabetes, or you know anyone as part of your network who has diabetes and will benefit from a peer support group, please do well to share this information to them. The group meets every first Mondays of every month and the fourth Wednesday of every month from 5 p.m. to 7 p.m. So the venues are different. For the first Monday, it's at Newton Heath Library, and the fourth Wednesday, it's at Simpson Memorial Hall. So please, if you want to know more about this, do well to email abundance@can.org.uk or call the mobile number on the screen. We also have our Keep Warm and Stay Warm. So it's a Cadent project. So if you're interested in learning around keeping warm and staying safe, because it's a very like crucial kind of area that everyone should be abreast with. So please do well if you're interested in getting free access to household equipment, to learn to recognize carbon monoxide signs, and then enjoy drop-in sessions and check eligibility for priority services. Please do well to register on the link provided on the screen, or email michelle@can.org.uk for Greater Manchester if you live in Greater Manchester. And then for Enfield, bernice@can.org.uk. We have our Africa Day coming up on the 21st of May. That's next week, Friday, from 10 a.m. to 3 p.m. And it's focusing on championing African businesses and celebrating our African culture in Greater Manchester. The venue is at University of Bolton. It promises to be very enriching and insightful, and yeah, as well being fun. So please do well to invite family, friends, colleagues, and loved ones to come and enjoy the day. Also, we have a healthy hearts initiative that it's an ongoing project that covers Moorside, Rusholme, Hume, Ardwick, alongside Openshaw and Clayton residents. So if you're interested in improving your heart health, please email info@healthyandhearty.org.uk or call 077 522 82681. As part of our health and wellbeing initiatives and services at CAN, we have our Green and Arts wellbeing service. If you're interested in it covers a range of creative and physical activities inspired by Caribbean and African culture. So we have workshops around painting, textile, nature walks, and etc. So if this is something that will benefit you or anyone from your network, please do well to email Green and Arts Wellbeing at can.org.uk or call the mobile number on the screen. Okay, I think that's it. Yeah, so once again, just to thank everyone for joining us today, and we hope to see you all next week.
Thank you.
I'll pass on to praise. Toby, are you there?
Welcome to our Caribbean and African Targeted Health Improvement Programme, CATHIP Health Hour. The Caribbean and African Health Network, CARN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.